Scott Brumley's back pain has slowly been getting worse.
And it's just gotten to the point as I've gotten older, it's gotten worse with time. So within the last year, it's really started hitting me really hard.
For him, it wasn't any one thing in particular that's caused it.
Life, basically hard life, working hard. Some of the things that, because of my age, if you could do it, you did. Today it doesn't matter if you can, get help. Time got me.
And it's dramatically changed how he lives his life.
When you're living in this kind of pain that I'm in, there are just things that you can't do anymore. You can't play with the grandbaby like you're supposed to. You can't go fishing. You can't perform your job as you should.
Previously, his best option might have been a spinal fusion, which would mean a loss of mobility. But now, through a clinical trial at St. Vincent's, there's a new option.
In this procedure, we still use anchors like screws to go in the bone. Then we put this device. It's a device that allows movement, and it goes over the screws and it sits posteriorly and it allows movement.
The device is part of what's called the TOPS system. It's for spinal stenosis. That's when your facet joints, which make your back flexible, start to wear down and your spinal canal starts to get narrower. Doctors in Europe have been using this new procedure for years, but it's still in the trial phase here in the US. St. Vincent's was the third hospital in the entire country to perform this procedure, and the first in Florida.
If we're able to remove the problem they have in their spine and make them feel better without doing the fusion, we're having an alternative to fusion. Well, most patients rather do the alternative to the fusion.
Here's how it works. Surgeons remove the facet joints and replace them with the device, essentially reducing or entirely eliminating a patient's pain while allowing them to keep their mobility. Dr. Chahlavi says it's a one-of-a-kind device.
This is a procedure that we've been thinking about for many years. I mean, there are other devices that tried to do this, but they were never very successful. It was either too complex to do them. This is the first one that's simple, it's easy to do. It's been approved in Europe for a few years now, and hopefully we're going to get it approved here in the US.
Patient Scott Brumley can't wait to see the results.
No, let's do it.
And he has a message for anyone with back pain.
Don't do what I did. Don't wait as long as I did until it puts you in this position. Definitely research and see what your options are. Oh, Dr. Chahlavi's great. I couldn't have asked for a better doctor. He's very understanding. He answers all the questions. He takes his time to communicate with me the things that I need.
To schedule an appointment with Dr. Chahlavi, call 904-296-3103.